Cabinet has approved two things. Firstly, the mandate under which DHBs will now negotiate, and secondly, funding to meet the cost of the resulting agreement. I've said before that it's my expectation that the pay equity claim, once agreed, will add hundreds of millions of dollars a year to the current payroll for nurses. This is still my expectation. This morning I've written to the unions, the DHBs and the Ministry of Health and invited them to commence negotiations on the pay equity claim as soon as possible. This has been long awaited and is likely to be the most significant pay equity settlement this country has ever seen. And it's not before time. New Zealand passed the Equal Pay Act in 1972, and still in many occupations, women earn less than men. We know that nurses are underpaid, and that is why we are committed to pay equity. Our resolve to reach a satisfactory agreement over pay equity for nurses remains undiminished. To nurses, I say I'm aware achieving fair pay is not the only issue that you're concerned about. Many of you are facing challenging conditions at work because of short-staffed shifts and the uneven rollout of Care Capacity Demand Management, or CCDM, which is part of the Safe Staffing Accord. On this question, I can confirm the following. I have established a nursing advisory group which will have the task of reviewing the implementation of CCDM and the underlying methodology. The 4 members of the group, supported by an independent, there will be 4 members of that group supported by an independent secretariat who will look at where CCDM is operating successfully and where implementation is not complete. The group will hear from nurses about what can be done better to ensure safe staffing levels. It will look at effectiveness, including staff satisfaction and patient outcomes, and whether CCDM is fit for purpose. I will confirm the makeup of the group in the days to come. The group will report to me in 3 months' time. Recognising pay equity and finding solutions to the current staffing problems are top priorities for me right now. We are committed as a government to addressing and resolving those issues. There is only one way forward on the pay equity claim, and that is to commence negotiations as soon as possible, and I urge the parties to do so. I want to be absolutely clear. There is nothing grudging about this government coming to terms with pay equity for nurses. This has been historic. This has been generations. And so we've known it's coming for 3 years. We've been prepared for 3 years. We now have a more accurate picture, which is what Cabinet looked at, and has given the green light to the DHB negotiators and said, go for it, we have to get this resolved. So there is now a mandate to do that.